Hello, my name is Zipporah Fennell, and along with my group members, Nafis, Carissa, Jade, Ashley, and Brittany, we're going to be talking about healthcare organizations and how they have been complying to new government requirements and mandates. Um, so the first thing that I'm going to talk about briefly is just an introduction. So when we talk about compliance to government requirements and mandates, this is really going to be heavily related to the ways in which organizations have adapted and face these challenges, different impacts that these requirements have had on organizations, suggestions that we have for these organizations to more effectively address the mandates and requirements, and also what we think the future might look like given continued government intervention in the healthcare industry. And as the cost of US healthcare continues to rise, this is something that will continue to be more and more relevant as we see various government agencies trying to intervene and help both providers and the patient populations that they serve. So our topic description, as stated before, there has been an increase in the cost for healthcare in the United States, and this has, had direct impacts on healthcare organizations and patients, and because of that, the government has intervened. A lot of the mandates that were put in place are within the legislation that is known as the Affordable Care Act. Some descriptions of what these mandates may look like is Medicaid expansion. So certain states could, or any state could opt into having increased in Medicaid funding. And this really positively impacted certain safety net hospitals because of the Medicaid expansion. They were able to increase their revenue and improve their operating margin, specifically in safety net hospitals that really relied on Medicaid funding. And this is just one example of requirements and mandates that changed that had an impact on hospitals. Another example is reimbursement methods. So our healthcare industry continues to shift from volume-based care to value-based care. And because of this, there are new requirements in place where organizations can be monetarily incentivized if they offer healthcare that is of high quality and effectiveness for their Medicare populations. Another area of compliance or requirement is related to medical billing and CMS's focus on preventing fraud, waste, and abuse. So they invested a lot of money on the front end to use different analytic tools to examine Medicare billing claims to make sure that there was no fraud happening anywhere. And those are just a few examples to kind of help with the description of what it is that we're going to be talking about throughout the presentation. So in 2018, the Department of Health and Human Services released a report along with the U.S. Department of Treasury and the U.S. Department of Labor. And in this report, they focused on 4 different areas that they feel government mandates and requirements should be altered and improved, and that's with the healthcare workforce and labor markets. So they made lots of suggestions related to kind of decreasing the barriers that people have to get medical education and the ways in which physicians can even practice once they do complete their education. Healthcare provider markets, so talking about different legislations like certificate of need laws and really removing a lot of barriers that organizations have to participate in the market. This is based on the assumption that with more participation, there will be more competition, and with more competition, cost will be driven down as a result. The provider markets also focuses on that shift to value-based care payment models that I touched on briefly before. So healthcare insurance markets, once again, reducing barriers to participation in these markets and making sure that patients do have, choice in what types of plans that they want to have. And then consumer-driven healthcare, making sure that there's transparency in pricing and that patients are able to make educated decisions on the type of healthcare that they use. So these are just some examples to help better describe the ways in which government mandates and requirements really impact the healthcare finance industry.
New government regulations, without a doubt, will lead to some challenges for healthcare organizations. A study regarding nonprofit hospitals and the Affordable Care Act regulations mentions that new regulations will impose 190 million additional hours of paperwork annually, require a financial investment in administrative personnel, limit time with patients, and insert government into the patient provider relationship. On top of the additional paperwork, the Affordable Care Act has increased demand for healthcare services because more individuals have access to insurance. However, many of the newly insured are covered under Medicaid, which reimburses less than the costs incurred to provide health services, which ultimately has a negative effect on revenues and profitability. Additionally, the population is rapidly aging, and a large number of individuals are joining Medicare every day, which puts a further strain on the healthcare system. The increased demand for healthcare services will also take a toll on the healthcare providers. Organizations will be asking more out of a limited number of providers. Therefore, not only will healthcare organizations need additional physicians and nursing staff to account for the increase in demand, organizations will also need to focus on retaining and maintaining staff satisfaction. New government regulations are leading to a switch to value-based reimbursement methods. These methods no longer focus on the number of procedures or services provided, but more on the quality of the services provided. This will require a completely different way of thinking about patient care. Healthcare organizations will take a financial hit unless innovative strategies and operational models are developed. Additionally, hospitals are facing penalties for excess readmissions or below average quality measures. In 2019, 83% of the 3,129 general hospitals evaluated in the Hospital Readmission Reduction Program received a penalty. The application of penalties is estimated to cost hospitals $563 million over a year, according to the Kaiser Health Network. Nonprofit hospitals are also required to conduct a community needs assessment, publicize the results, and create an implementation strategy to meet the needs of the community every 3 years. Under the law, hospitals face a $50,000 penalty per year and a potential loss of tax-exempt status for failing to complete the assessment. Healthcare organizations will need strategic planning and coordination to account for the constantly changing healthcare system. The healthcare system is transforming more toward low-intensity care and less expensive settings by utilizing outpatient facilities more so than inpatient settings. Hospitals must develop a system that will be more toward a preventative health model. It will involve more coordination between primary care clinicians, specialists, hospitals, and community health centers to keep patients healthy and reduce the need to occupy hospital beds for an extended duration. Healthcare reform and the changing payment system is altering the financials of many organizations. For example, nonprofit hospitals are seeking long-term partnerships and joint ventures with nonprofit and for-profit systems. Overall, healthcare organizations need to be able to adapt to a rapidly changing environment and learn how to navigate new government regulations to ensure viability of the organization.
Hello, my name is Nafis, and I will be covering the next portion of the presentation. So I will be discussing how organizations will be impacted by these regulations. So essentially, what is happening is that more work is being created for these organizations, so there's more administrative burden added onto it. As we know, compliance is an ongoing process, so everything must be consistently and constantly reviewed and examined to make sure that all of the processes and the procedures going on in the organization are compliant. As we know, the laws and mandates and the interpretation for these laws and mandates are constantly changing. So it's very important that organizations are doing their level best to stay updated. Also, another way that more work is created is that because these laws and mandates are constantly being updated and changed, the training material is also needed to be constantly updated. So the training material also has to be continuously updated in order to provide the most relevant and latest information. Another thing that may end up happening is that some organizations may need to create a new department in order to meet the demand for the mandate. So this is more applicable towards smaller organizations where they had just like a team of people working on it, but now because of the increasing demand to meet compliance, to be compliant with certain regulations, it may be beneficial for organizations to just create a whole department that will deal just with compliance and enforcement. All right, so another way that organizations are impacted is financially. So organizations are kind of stuck because they either have to comply, and if they don't, they will face a penalty. So, for example, employers underneath the Affordable Care Act are obligated to provide their employees with health insurance that is affordable and that has minimum value. So here, minimum value means that it is providing a majority of the coverage for the employee, their family, and their children up until the age of 26. So if they don't provide this, they would have to pay a monetary fee. Another financial impact would be that they'll see increased expenses in many different things, such as training. So, like I said before, because the laws and the mandates are constantly changing, the training material has to constantly be updated as well. And in order to have that, you need additional resources and you need people. And in order to have additional people and resources, you need money to back that up with. So that's why it leads to some sort of financial burden for the organization. Also, something that may end up happening is that the fee schedules may be restructured based on the requirements. So depending on how physicians or organizations were originally paid or were paying out to their employees, that may change depending on what is being asked of the organization. All right, so not all of the impacts have to be negative. There are some positive impacts, such as the organization can identify and modify any areas of improvement they may not have noticed before. This is actually a really good thing because it is better that the organization identify any areas of improvement, any flaws, before they are audited and then penalized for misconduct. And this can also help them avoid any criminal charges as well. Also, the organization will see an organizational or an administrative impact. So like I was mentioning before, they may have to restructure or remove certain departments. They may have to modify and reconsider certain procedures and policies. So as we know, the purpose of compliance is to improve patient care and satisfaction and to improve employee satisfaction as well. So some organizations may really have to literally restructure the way they work in order to meet these conditions. So, for example, it's not restructuring a whole department, but an example would be employers now being required to provide affordable healthcare insurance for their employees. Another example would be the way insurance is handled. That may be different than how it was before. Okay, so lastly, the image of the organization can be impacted. So if they are able to successfully adhere to compliance, an organization will have qualified professionals to lead organizations. This can be really helpful and really beneficial because this can help create a more effective and efficient organization, which will have a positive impact on the community and a competitive edge in the market. All right, so that is the last part from my bit, and I will pass it on to my next team member. Thank you.
This is Carissa Hinks, and I'm going to be discussing what other measures we would recommend for any new government requirements and mandates. The first is going to be the adoption and investment of additional technology to measure care outcomes. This is significant because as the Department of Health and Human Services and the Center for for Medicare and Medicaid becomes more involved and more strict in their value-based payment guidelines, it's going to be invaluable for health systems to have technology that will allow them to collect, analyze, and assess, and then report back their own data on their care outcomes as defined by the Center for Medicare and Medicaid Services. The second thing I would recommend is data collection throughout the entire episode of care, not just at intake. This is important because every little detail during a patient's care can be a significant factor in their outcome. The third is a quality strategy that includes everyone, not just clinicians. Every single person in a health system is fully involved in a patient's care. While they may not be directly touching that patient, they are responsible for ensuring that patient's outcome, from the janitor all the way up to the financial analyst to the CEO. So it's important that everyone understands the quality strategy as well as their role in it and how it can impact both revenue and patient outcomes in the long run. And then fourth, I recommend that if they don't already have one, that they hire or train a chief quality officer, somebody who can help to adopt and invest in the right technology, and then also provide additional training and aid to clinicians and to other departments directly involved in patient care, and then ensure that that quality is the highest it can possibly be. Fifth, I recommend we utilize a qualified and skilled third party to reduce the administrative burden. With over 190 million additional hours spent on administrative tasks today, it's important that we take as much off of the clinician as possible. And it also is a great way to reduce overhead costs as well as payroll costs by finding a skilled third party who can cut down the amount of time it takes to go through those administrative tasks and help the organization move forward. I do believe that it's going to be important to engage the community, ultimately to improve health and prevent and create more preventive care options. As we know, preventative care can help reduce unnecessary ER use, as well as the appearance of chronic conditions if the preventative measures are taken early. So with preventive measures, we can actually reduce costs both for the health system as well as for the GDP and healthcare overall. And then finally, I would recommend promoting the physician assistant role through local school events and scholarships. We know that there's a physician shortage. We know that a nursing shortage is here as well. And so I believe the physician assistant role is going to be a great way for us to continue to maintain the caliber of relationship that we provide our patients while still making sure that those patients are taken care of and that the nurses and the doctors feel supported through their work. Thank you for your time.
Hello, my name is Jade. So my topic is based on research, how are organizations responding to the challenge. So based on several papers that I read, organizations respond to the challenges with the ability to change, adapt, and evolve. At this point, we all know the health care industry is constantly changing with great speed and volume. So understand the reason why a new policy is challenging seems to be the first reaction to most organizations. As the previous slides determined, the Affordable Care Act is a great example to how organizations react to challenges to a new act. The shift in payment, which determines the way physicians get paid, this is what we call value-based payment. So value-based payment is basically the traditional service payment program, which means payment for individual service or task done at a specific time period. It is being pushed out by bundle payments, and bundle payments is, according to the Commonwealth Fund, given providers a single prospective payment for treatment of a surgical or medical condition. So the Affordable Care Act is driving towards better preventative care, as well as primary care doctors will face more accountability and responsibility towards determining the health risk for patients prior to the occurrence of any chronic conditions. And to continue on, based on research, how are organizations responding to the challenge? So, according to the change management model, the primary goal is to identify what health policy or law is changing. Going back to using Accountable Care Act as an example, why a new policy has been implemented in the first place. What is it actually benefiting? Why did they implement it in the first place? The question is mainly how to implement and adapt to new challenges and new changes within an organization. And it seems like most organizations maintain a separate department to prioritize the enforcement of most current policy to follow. For example, the Human Resource Department is the most common department that takes charge of prioritizing the enforcement of policies. And Brittany is going to take over for our next topic, and she will also conclude our presentation.
What does the future hold, you may ask? As this year continues to bring on new challenges, the healthcare executives will have to adjust to what is transpiring in the nation today. One aspect leaders will continuously have to embark on is staying up to date with policies and procedures, especially in a world that has been reconstructed due to COVID-19. Executives will have to listen to their patients' desires in regards to how they feel regarding their experiences within the healthcare system. Being able to listen effectively, for one, listen effectively to what the patients are saying, and having empathy will definitely keep the healthcare system in a great standing with the patients in the surrounding areas. And another aspect that we will look forward to in the future as leaders in the healthcare field is price transparency between patients and providers. It's very important that we be upfront and direct about the type of prices and the fees of our services that we do offer. And it is important that we go over the various of ways that each patient can pay for it, whether if it's through government assistance or employer-based insurance. Also, I believe there are 3 other aspects that we should keep in mind when regarding what does the future hold for top executives when complying with government policies and mandates. Unity is one of them. It's very important that unity is established amongst every spectrum of the healthcare leadership, whether it's executives or if it's the frontline staff that has direct clinical care with the patients. The patients do have a tendency to grasp an understanding of how each person work with their coworkers. And if we establish unity from the top executives down to the frontline staff, we can ensure that our future is bright. Also, effectiveness. Implementing effectiveness is another approach leaders look to take on in the future. Leaders want to overcome their challenges like the ones we discussed earlier and deliver quality services to exemplify how well the organization is operating with the effectiveness of our staff. Which also brings me to my next point, stability. Every moving part in a healthcare organization has to constantly perform their job, regardless if it's low performing patients who do not which brings me to my next point, stability. I truly believe that every moving part within the healthcare organization should constantly be doing their job, regardless if the lobby is full to capacity with patients or if we are experiencing any shortage within patients. every staff member should be able to be stable within their jobs and to perform their jobs at any cost, regardless of the climate that is currently set. Also, being able to maintain our vision and our culture that has been set for our healthcare system will definitely yield growth in the future for our healthcare system. And this quote that I truly believe will give us the boost we need for the future. If everyone is moving forward together, then success takes care of itself. Truly believe that Henry Ford set the tone for how healthcare leaders and everyone in the healthcare sector should work together, especially moving forward in the future. To conclude this presentation, I will discuss some of the major points that has been previously stated. The Affordable Care Act has been the staple of healthcare within the last decade. The ACA has given healthcare organizations ways to structure their finances in regards to how patients should pay for their services and how physicians are reimbursed. As the Department of Health and Human Services, they have recently reported highlighting suggestions on price transparency so patients can always be informed about their healthcare spending. As for the challenges the executives may face, they will continue to witness an increase in demand for government assistance because of the ACA. Rather, if it's the aging population always continuously seeking the government for assistance, or leaders just going head to head about revising the act, the ACA will be a challenge. Another challenge to highlight is retaining nurses and physicians. There is currently a burnout and a shortage of frontline workers. It will be the healthcare leaders and executives' job to create a strategy to overcome this obstacle. As future healthcare leaders, we will need to modify areas that currently need improvement. Whether it is the creating new jobs to reduce those burnout frontline workers, or creating a culture that better fits our organization and our current staff members. Improvement is an aspect that will impact change for the better. Adhering to compliance and guidelines set from the government will also impact our healthcare sector. One way to respond to the challenges we may face is to predict the change that could be happening in the healthcare industry. Everyone on the leadership and executive board should remain one step ahead to anticipate any hardships that may come our way. That approach will yield the organizations to evolve into a system that knows how to incorporate government policies and procedures. Another recommendation to include is to be consistent in collecting data throughout a patient's entire stay within a hospital or an outpatient clinic. This approach will come from the new quality strategy that will be created from leaderships, managers, and our exec board. With that being said, the future can look bright for the healthcare executives if they promote unity and consistently stay up to date with the current government procedures and policies. And this does concludes our presentation. And this concludes our presentation.